Many medical conditions can be uncomfortable to talk about, including urinary incontinence.
Essentially, it's the loss of bladder control, and it may seem like you're alone when you're going through that problem, but in reality, you're not alone. 18 million American women are right there with you.
So morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor more about the problem and what can be done.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
And that's right, ladies. Although it may seem embarrassing, it's fairly common. However, the good news is, in many cases, there are things that you can do to improve urinary incontinence. So with us right now is Dr. Esther Hahn, a urologist with Orlando Health. We were just talking about being moms and how this is a really common problem. So how common is it really?
Yeah, so as mentioned previously, 18 million American women have incontinence, and that is a huge number. So really, we all know somebody, and I mean, I'll say I definitely had issues with it after delivering. So we all know someone who has bladder leakage issues.
And usually you talk to an OBGYN before you have a baby or at some time in your life, and they'll tell you that, like, be prepared for it. This is what could happen.
Yeah.
So it shouldn't be an embarrassing topic.
It shouldn't. And you know, women just bear a lot of things without talking about it, and a lot of times they, you know, they're like, oh, it's something my mom, my grandma went through. It's not worth bringing up.
Right. So how do you talk to your patients when they do tell you that this is going on? How do you reassure them that, hey, we do need to give all these details and really be open about it?
Absolutely. So whenever my patients come through, I always have questionnaires. It kind of helps bring out things, and then we talk about it. So really, whenever I talk to my patients, I say, if it doesn't bother you, it doesn't bother me, but let's have a discussion. So are you doing things differently now? Are you not doing things that you used to do? Is this really changing your quality of life is the question.
And there are differences, right,
Yes.
between the different types of incontinence. So can you explain what some of those differences are and why it may be important to point out what's really going on?
Great question. So the main two types we're talking about are stress urinary incontinence and urge urinary incontinence, or also known as overactive bladder. So if I break it down, we've got your bladder, we've got your urethra where you pee out of, and then you've got a sphincter. So pump, pipe, valve. Overactive bladder is when your pump is just hyper. It's just pumping, pumping, pumping. It's prank calling your brain, telling you you have to go when you don't actually have anything in there. When you have a leaky valve, that's the, oh my gosh, every time I jump, I cough, I sneeze, I leak a little bit. The reason why is in the past we had a nice strong pelvic floor, so every time you coughed or sneezed, there was a nice backboard. Over time with babies, you just have a weaker floor, and every time you cough or sneeze, there's nothing to stop you from leaking. Things like constipation, your diet, caffeine, estrogen levels, those can all affect your bladder and lead to overactive bladder.
Okay, so are those things you can test for?
Yeah, so generally speaking, it's sort of like a real life test. Like, people will always just kind of tell you they're leaking. Sometimes it's you know, a little bit confusing which one it is. Most people will have both. We do have some studies that we can do, sort of like an EKG for the bladder, or we can even take a look in the bladder.
That's good to know, though, because people are familiar with an EKG, you know, just little stickers almost that you put on and you find out. Is that sort of how that test would go?
Yeah, it's a little bit more. We do have to put a little baby catheter in the bladder to measure some pressures, but yeah, it gives us a lot of information.
Wonderful. Now, so for your patients who come in and then you diagnose the issue, how do you resolve it? What are some solutions?
Yeah, so we definitely always start with conservative things. So, you know, cutting out caffeine as much as you can. I don't try to take it away from anybody. Things like exercise and weight loss can help with both. Easy to say, hard to do. Physical therapy is huge. I recommend that for most of my patients. A physical therapist can really work with you on strengthening that floor. It's exercise, so you have to keep at it.
Yeah.
If those things fail, then we can move on to procedures, essentially.
Okay, so talk about physical therapy, because I think that's a great option for people.
Absolutely. So physical therapy, the studies will show if you work one-on-one with a therapist, you have much better results. I always ask my patients to perform a Kegel whenever I'm examining them. Half the time, they're not really able to contract their vagina. They're really kind of doing a butt clench, and that's not what you want.
All right, so just working with somebody who's a professional at this, talking to your doctor about it, not hiding it.
Absolutely.
Some ways to try and solve this very common problem.
Very common.
All right, thank you so much, doctor,
You're
for being
welcome.
a part of this segment. I'll send it back to the ladies at the desk.